Okay, we're going to do an assessment of the lower extremities. The first thing I'm going to look at is the color. So I don't see any abnormal discolorations, there's no cyanosis, there's no bruising, and there's equal hair growth on both extremities from top to bottom. The next thing I'm going to look at is edema. There's no edema on either extremity. Do you have any pain in your legs?
Just the knee.
Do you have arthritis?
Yes.
Okay. I see this knee is kind of disformed because of your arthritis. In gout, a lot of times it starts in the big toe, but I don't see any deformities of your big toe. There's no redness or swelling of the joint right now. Are you diabetic?
No.
No. I don't see any ulcers. We'll look at the toenails now. There's no fungus. All the toenails are present. No ingrown toenails. Now I'll check capillary refill. Capillary refill is 2 seconds on each foot. Now I'm going to go ahead and palpate the pulses. Femoral pulses are 2+ bilaterally. Popliteal pulses are 2+ bilaterally. Posterior tibial pulses are 2+ bilaterally. Dorsalis pedis pulses are 2+ bilaterally. The next thing I'm going to look at are the bottoms of the feet. There's no ulceration, no calluses, no redness, no cracks. Now I'm going to assess temperature, starting with the feet and working my way up. The patient's legs are warm bilaterally, they're equal. Next we're going to do a pedal push. And the other way, pull up. Okay, they are both strong. Alright, now we're going to do the Babinski reflex. That should go away after 2 years of age, but if it's still present, it could mean a brain injury. There's no Babinski reflex. Okay, now I'm going to assess the calves for any hardness, pain, or swelling. Okay, they both seem good. Now we're going to assess for any varicose veins. I do see a few. How long have you had them?
Since I was about 20.
Oh, that's a long time. Okay, so we're going to assess the legs now. If you could just lift this leg straight up.
What is it? Like that.
Okay, now the other one. Now I'm going to do flexion of your knee, if you can just bend it, and extension. Okay? Now for this side, flexion and extension. Okay. Now we're going to do external rotation and internal rotation. Okay, bend your knee. External rotation and internal rotation. Okay. Now if you can just take both of your foot and make a circle. Yeah, now the other one. Great. Now we're going to assess the range of motion of your feet. So if you can just push both feet up and down and touch your soles together and turn your soles out. Okay, great. I noticed you had a mole on your leg, so I'm just going to check it, make sure it's symmetrical, that the borders are even, it's one color. It is larger than 1/4 of an inch. Has there been any recent changing to it?
No.
Okay, it looks good. Now I'm going to just put the paw socks on your toe here and see if we can pick up your oxygenation. We'll do the other one too. Alright, 98% on both of them. Okay, the next thing we're going to assess for is for abduction and adduction of each leg. So I'm going to take this leg and move it this way for abduction and this way for adduction. And while I'm doing this, I'm going to be watching for muscle bulk equality and the muscles in each leg seem equal. Did you experience any tingling while I was doing that?
No.
Okay. Next up, I'm going to be assessing your ability to identify a really light stimulus. So I'm going to touch your leg with a cotton ball, and every time you feel it, say yes. Okay?
Yes.
You have to close your eyes. Yeah.
Okay.
Okay?
Yes. 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 Yes.
Good. For the next assessment, we're going to look in between the toes. Oftentimes, this is a very neglected spot, but the beginnings of ulcers can kind of hide in these areas. The next thing I'm going to do is I'm going to assess your ability to tell the difference between blunt or sharp feelings in your legs. So I'm going to have you close your eyes, and I'm going to tap you with a pen with on either side, and you tell me if it's blunt or sharp. I'll give you an example first. That's what sharp feels like, and that's what blunt is going to feel like. Ready?
Okay. Sharp.
Say it loudly.
Sharp.
Good.
Blunt. 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 Sharp. Blunt. Sharp.
Yep. Very nice. So the next thing we're going to look at is your stability and your gait. So if you could just walk maybe 10 feet with one foot in front of the other, you can go ahead. Next, just walk with your heels only. Next, just walk on your tippy toes. Did you experience any pain while you were doing that?
Just in my knee.
Your knee hurt where you had the arthritis?
Yes.
Okay. The next thing that I'm going to assess are the location of the iliac crest. We're going to keep in mind that this patient had scoliosis at some point in her life, but you can go ahead and bend over. That's good. And they are even and in the same spot, so. The next thing we're going to do is the Romberg test. So if you just keep your hands at your side, and I'll put my arms out in case you sway a little bit, and just close your eyes, and we're going to be testing your balance. Okay, good.